Let's talk about our community metrics. Here we go. Let's start by just talking about the people that live here. There's about 7.6 million of them in the 9-county Bay Area. Those are all the 9 counties that touch the waters of the Bay. 7.6 million, that's not nothing. In Silicon Valley, the way that we've defined it for the purposes of the index, we've got about 3 million. If you look at exactly just the 2 counties, San Mateo County and Santa Clara County, then your number is about 2.7. But remember, our definition, we take in part of Alameda County. We even reach over to Scotts Valley over the hill, and so that's how we come up with the Silicon Valley population, which is about 3 million. There's a clock on our data dashboard, siliconvalleyindicators.org, and you can see it moving in real time every time a baby is born, and it's calculating our population with precision. But anyway, think of us as about 2.7 million people in those 2 counties, and that's what our population trends have looked like. In around 2017, we started shrinking as a population, and I want to talk you through that. Of course, we had about 50,000 people leave the region during the pandemic. Some of those are coming back, but we took a population hit there, which delivers us to about where we are, 2.6 in those 2 counties as of the end of the calendar year. That's a growth in population of about 4,100. You might think that's a big number. We think it's a small number. We used to be growing at a more robust rate. And so I'd like to actually unpack for you the components of population change so that we can understand this a little bit better. The major component is to look at births and deaths. And so when you count a population, you take all of the births and you subtract the deaths. Well, there's something that you should know about Silicon Valley right now. We are an aging population. We're calling it the silver tsunami. And this is happening at faster rates than we've ever seen before. I'll show you some charts about that. So that's happening. But there's also a very significant thing happening, not only here, but across the nation. This is a national trend, and that is the declining birth rate. In 1990, we were giving birth at this rate. In 2025, that has fallen by almost 50%. So that's tectonic. There's something fundamentally different now about our population and the way that we grow. Okay, so you're subtracting a 50% smaller number of births from the number of deaths, and so our population no longer growing as quickly as a result of that. Now, in our population here in Silicon Valley, we have 2 sets of people. We don't like othering either set, but there's a set of people that were already located here, born in this country, located here, have then located in Silicon Valley. We have that set. And that set, their numbers fluctuate from year to year. And what you should know is that over the past decade, that set of people who are already located here have been leaving Silicon Valley. They're leaving. And that's your net domestic migration is what we're calling that. It's a negative number. That's the number. Last year, almost 20,000 people who are already here, decided that they would leave. So we've been seeing that for a run of years. We do a poll in the fall every year, and we ask this question as a part of the poll consistently. We ask, are you making plans to leave the Bay Area? And for the last several years running, that's been a high number. People saying, yes, we're planning to leave the Bay Area in the next couple of years. We would probe even deeper. We'd say, well, why? What's driving you out? And they would say, the housing, stupid. And so we've just understood our region in that way. Actually, the poll is trending the opposite direction in the last 3 years. In the last 3 years, people have been saying, no, we're actually not planning to leave. In fact, 57% of respondents are saying, no, I have no plans to leave. So that's, we're gaining ground in that way. Now, we looked at that segment of our population that were leaving the area, and we thought you'd be interested to see a little more granularity. We discovered that of that set leaving, fully 25% of them didn't leave the Bay Area. They left Silicon Valley by our definition, but they moved to the perimeter of the Bay Area. And again, the answer to that question, housing stupid, it's more affordable around the perimeter. And so a quarter did that. Then another quarter we discovered were still in California. They're living in what I like to call greater Silicon Valley. They are up towards Sacramento, Folsom, places like that, and also going southward. But still within a drivable distance, and that makes sense because some of these are hybrid workers, and they can come in, do some couch surfing, show up for their employer, and so that's really how we should understand about half of the population that has left. They're still nearby. The rest are going to these other American destinations, and that list is in order. So the most have been going to New York City, followed by Seattle, followed by Washington, and et cetera. That's where they're going, about 13% of the departures. And then the other unaccounted for just going to other American destinations. Okay, so that's one segment of our population. We've talked about natural change, that's births, deaths. Then we've talked about the folks that are living here, whether they're leaving or staying. And now we'll talk about what has always been Silicon Valley's secret sauce, and that is that people come from outside the country, other places, and they have come to Silicon Valley to pursue this path to innovation and entrepreneurship and education and all of the opportunity that is here. On this chart, what we're showing you with the bars on top is actually it's the bars on bottom. We're showing you the net foreign immigration. I'm trying to look at my colors. Okay, there it is. The net foreign immigration is the bars on top. The color doesn't differentiate enough for my taste. That's a funny PowerPoint thing going on here. But the bars on top are showing you on net how many people are coming to Silicon Valley from someplace outside of the country. And as you can see, we're mostly growth positive. People have come to this place from all over the world, and it's been a very popular destination. And then you can see that starting in around 2016, those bars were starting to tail off until we got to very small numbers trickling in during the pandemic. Those bars trailing off correspond to national policy directions, the tenor, the tone, the culture that's being created around immigration in our nation. And so you can see that fewer and fewer people are choosing to come into our region. And that carries us to 2025 finally, and you can see that we grew by 13,000. That's our net. So there are people not born in our country living in Silicon Valley who are leaving. That's happening, but there are also people coming from other places into the region coming in. The net, when you add them all up, is 13,000 new residents living in Silicon Valley from other places. That number, 13,000, is down from the previous year, just so you know. Again, it corresponds with the policy direction that our nation is taking. We see a pretty clear correspondence with that. And so our inflows in are actually trailing off. And that could be an ominous sign for Silicon Valley. Remember, we're losing people that were here. They're going to other parts of the country, but for a long part of our history, they have been replaced by people who are coming from other parts of the country and populating the tech economy. Thought you might be curious about the characteristics of the people who are coming in from other parts of the world. This chart lays it out. You can peer at it in the index when you're holding it in printed form or on your computer screen. So I'll just highlight a few things. Their average age, people coming from other countries, they're young. They're in that young working group. Average age 34. They are tilting Asian. Almost a majority Asian coming here. They are highly educated. We'll see other charts about that. And they're not married. Majority not married, coming to our region and charting a life here. Okay, so that's happening. Now, I want to look at our population in terms of our age distribution. And I told you this, we're an aging population. Currently, at this point in time, 17% of our population are above the age of 65. The boomer generation is moving into that segment now. And then if you look at the other end, it's 19% of our population are young children, school-age children. And that segment is actually shrinking. And then let me show you this. In the middle is what we call our core working group. Those are people that are between the ages of 25 and 44. Economists, labor economists in particular, like to look at that group. They think that's the key to a thriving economy. That's the group that is inventive, creative, bringing all of those skills to bear, especially in an innovation economy like ours. And so the question is always, is that segment of your population robust, and is it growing? For us, not growing. It's staying fixed in place, but we're growing, we're making dramatic changes on the other two ends of the barbell. Now let me show you this chart. This shows you the rates. So our seniors that segment has grown by 29% over the past 10 years. That's pretty dramatic. And then you can see that our kids, our school-age children, have shrunk by 15%. This is a major trend. In the papers just this week, San Jose Unified School District is proposing that it close 1/3 of its elementary schools. And there is a hue and a cry that's going out around that proposal. But this is what's driving it. Let's be very clear about it. Fewer young people in the region, fewer young people coming to the region. So that's a trend that we want to mark for you. Now, we're always interested to look at our composition by race and ethnicity. I cherish this about our region. We are one of America's, one of the planet's most diverse regions. Let me show you what that looks like. In 1990, we were 59% of the population were white or Caucasian, like me. And that was the majority slice of our population pie. Well, guess what? By 2024, this is the last reporting period, and we're using the census for this data, whites had become 28% of the population. Right around 1990, there was a shift, and Silicon Valley no longer had a majority ethnicity. They all made up minority pieces of our population pie. So there's what happened to the white population. It's now constituting 28% of our pie. And meanwhile, over that same period of time, Asians were at one point 17% of our population. Today, they have swollen to 39% of our population. So that's what we're looking like. And then there are the other segments. By the way, in the index, you can look at it, and we have granular information about this, including points of origin and all of the rest. But the segment of our population that is Hispanic or Latino has remained fixed over this 25 period of time, around a quarter of our population. And then for your interesting information, the Black or African American members of the Silicon Valley population, not the Bay Area, but the Silicon Valley population, are at about 2%. So that's what our population pie looks like. Here's the percentage of our population who are foreign-born, as I was describing. They originate from someplace outside of our country. That number is 40%. So look around you. 40% of the people that you see weren't born in this country, born in some other place. If you did that same exercise in the United States as a whole, guess what? It's 15%. So here we are, one of the nation's most diverse places. It's a very educated population, just so that you're aware. 57% of our population holds a college degree, and another 20% of our population is holding multiple college degrees, including even PhDs. So highly, highly educated. The comparison with the United States is 37%. 37% of the American population overall holds a college degree. We're 20 points higher than that in Silicon Valley. Now, we thought we would look at the tech talent. I've said this many times. Silicon Valley is not an American phenomenon. In fact, you could even say it's not a California phenomenon. It is an international phenomenon. Silicon Valley was built by people coming from all over the world, and clustering here because it represented a place for opportunities to do these rarefied things that typify our economy. So right now, as of the last census, guess what? Only 13% of the people that are working in tech are from California. Only 13%. And then there's another 17% that were from the rest of the United States. So that adds up to 30%. So not even a third of our tech workforce are American-born. 70% or more are from other places outside of the United States. And this pie is breaking it down for you. So you can see that the biggest slices of our tech pie are 70% Chinese and 26% Indian. And then all of these other smaller slices that are coming from South America, Central America, Eastern Europe, and every pocket of Asia, not just China and India. So these are very distinctive features. Now, immigration is a major topic, a divisive topic for our nation right now. So we just thought that we should be relevant to that conversation so that people here know just what our actuals are. So here is that set. Remember, you take the 40% of our population not born in the United States. If you look at that set of people, 50% of them are naturalized citizens. They've become American citizens. Then another 30% are lawful, which means that they are holding a green card and living, working here lawfully. And that leaves about 20% that, by our best estimate, are undocumented. So that's what we're talking about. That 20% translates, we think, to about 225,000 people in Silicon Valley, undocumented. Now, that's not a precise number. We can't be precise about that because there's lots of moving targets out there. But that's an estimate, and it's a very educated estimate. So that means that in our current climate, there are about 225,000 of us who could be detained or deported or otherwise. Okay, so this chart doesn't count, by the way, H-1B. The H-1B visa. And we're one of the nation's highest concentration of H-1B visas. And at the last approval cycle, 47,000 of those, once again, assigned to Silicon Valley and Silicon Valley companies. That's not your total number of H-1Bs. They come in 3-year cycles. So we think that the number is 3 times that. Think of it as about 150,000 people in our workforce that are on that H-1B visa, which has to be renewed continually, and the renewal is not a given, and the eligibility requirements are substantial. Okay, now, we've described the population, we've described its demographic characteristics. Now I'd like to talk about how that population is doing from the standpoint of income and wealth. So let's dive right into that. This chart is showing you average annual earnings. So you take a random member of our population and you add up salary, bonuses, stock, and capital gains, any form of compensation. And the average number is 209,000. 209,000. That's your average. Now, that's a high number, but remember, we have a lot of very high earners in Silicon Valley, so it skews our averages. It makes it very high. Nevertheless, there it is. That's your average annual earnings in the region, 209,000. I want you to look at the nation by comparison. The national average for earnings is 86,000. So we are not 1 times more than that, not 2 times, more than 2 times the national average. This is an extraordinary chart. It's showing one of our most extraordinary characteristics. Okay, so that's how we look by averages. But we don't think average is actually a very good measure. And so we like to track every kind of measure that's available to us. One that we think is telling a more telling story is the median household income. I'll remind you that median means it's that breaking point. Half of the households will be more than the median, half of the households will be less than the median. And so that's where we stack up in terms of median household income, 162,000. That's your median. And remember, there might be multiple earners in that household. But again, let's compare that to the national average, and that would be 81. So here again, twice twice the national average. So again, yes, we're a prospering region. We also like to track income by education and by ethnicity. And when we started doing this in earnest, we discovered some things. One is that we discovered that there's grotesque disparities across the ethnicities, and that those disparities are persisting. We haven't made any substantial progress on those disparities over the past decade or more. So that's one thing that we report in the end text, but take no pleasure in. Another thing is this. This is showing you the correlation to the level of education. We're correlating income to your level of education. And of course it correlates. The more educated you are, the more you tend to command in the marketplace in terms of salary. However, there is an anomaly here. It's showing that people at equal levels of educational attainment actually have a salary differential. So if you're Hispanic or Latino, you're actually making about 60% less than your counterpart. If you're Hispanic or Latino with a bachelor's degree, you're still making about 60% less than your counterpart in the segment of our community that are white or Caucasian or Asian. So that's a significant finding that we're also publishing in the index. We also just wanted to show the vast disparity across income categories. And so we just picked the two at random. Well, no, they're not at random. We wanted to show the high end and the low end. So the highest end is tech. These are people working in tech, and their average wages in tech are around north of $400,000. That's the average. And then this is also showing you another sector, and that would be hospitality. So folks working in hospitality are below 50,000. And so we're showing you the gap, or we're showing you the disparity between those two segments, and it's the biggest disparity that you'll see across the country. If you were to compare tech and hospitality in other regions, that disparity would narrow substantially. So this is another thing that we have to understand about Silicon Valley. This is a chart that's brand new to the index. Our team continues to look at other ways to understand income and therefore to understand us and what's happening in our region. And we learned that, yes, there's salary, and we can see where we stack up with salary, but it turns out that a more descriptive way of expressing the wealth in Silicon Valley is to look at the performance of assets that are held by people, and those assets are, of course, under management. So the assets are in a liquid form. They have been placed into instruments, and they're returning dividends to the holders of those assets. And it turns out that outpaces their salary gains. So another way we need to understand Silicon Valley is that it's not about the salary. It's about the assets. And this traces back to our origins, which is where we invented this notion that if you are joining a startup company, sure, you'll be paid a salary, but you'll also be awarded an ownership stake, and that stake can appreciate. And sure enough, that is leading people to the kind of wealth that nobody ever imagined. Okay, so now we have both kinds of things going on: earnings from assets, earnings from income. And it leads to this kind of an outcome. We have 126 billionaires in Silicon Valley. They're now in the political crosshairs. As you know, there's proposals that there should be a billionaire tax. So there's a wide range of feeling on that proposal. But that's what we're talking about, 126 billionaires. That's the highest collection anywhere on the planet, with one exception. That would be Hong Kong. So here we are, Silicon Valley. That combines Silicon Valley with San Francisco. But maybe you didn't know that there are 146,000 millionaire households. 146,000. We are only talking about liquid wealth here, liquid assets. So there are 146,000 households that have, in a liquid form, at least $1 million. And that is not counting the value of their house, not counting that. Okay, so this also tells you something about our region. There's another way to look at income, and economists are especially fond of this measure, and it's called the Gini coefficient. Let me explain it to you. The Gini coefficient is measuring the distribution of income or the distribution of wealth. And so if you are 100 on the Gini scale, that means that one person holds all of the wealth, okay? And if you are 0 on the Gini scale, that means all of the people are holding all of the wealth equally, okay? By the way, we ran our own calculation because we were curious. If you took all of the wealth in Silicon Valley and you distributed it across every single Silicon Valley household so that we were literally 0 on the Gini, guess what? Every household would have $1.2 million. Yeah, that's the kind of place we live in. Now, the United States is at 59 on the Gini scale, so in that mid-range. This isn't overly upsetting to developmental economists. Now let me show you what's happened with Silicon Valley. In Silicon Valley, we were at about 37 on the Gini scale in 1990, 37. Way down on the Gini scale. By 2020, when the pandemic set in, we had gone to 83. That's where we are, okay? That, too, is an extraordinary number. I just want to mark that. That's extraordinary. Now, people who study developing economies will tell you those are the conditions for instability. Those are the conditions where you will see coup d'etats and revolution, blood in the streets. This is France. This is France in 1790. That's how developmental economists would describe what's happening in Silicon Valley. So we need to see ourselves through that lens. It's not the only lens, but this is happening in the region. Now, here's a pie chart that is telling you more about the distribution of wealth in our region. And so we know that a lot of the wealth is held by very few people. And then we know that folks that are at the lower tiers of the income ladder, they're not holding as much of the wealth. I think you know that intuitively. But here's what this pie chart doesn't communicate just immediately to your eye. And so I decided I would just put it in plain English for you, okay? In Silicon Valley, households that are in the top 10% of earners are holding 75% of all the wealth. Okay, you got that? That number, by the way, 75%, grew 5 points over last year. 5 points. Last year, when I stood here, I told you it was 70%. Okay? All right, so the top 10 holding 3/4 of all the wealth. Now, the households that are in the bottom half of the income scale, the bottom half are holding less than 1% of the wealth. Okay? So that's how we stack up in our region. Again, a very, very distinctive property. You won't see this in any other American region. You won't see it in many places on the planet. In fact, we may be unique. So there's that. Now, let's take a look also at what's going on with earnings. This is a chart that shows you income growth over the past 20 years. And it's plotted out. So if you are in the 90th percentile, if you're a member of that set, our top earners, over the past 20 years, you saw your income grow by 30%. If you were in the next percentile, 80th percentile, you saw your income grow by 28%. If you're right in the middle, your income grew over those 2 decades. It grew by around 14%. But then you look at the bottom half on the income ladder, and if you were in the 20th percentile, you had no income growth. Your wages stagnated. If you are at the bottom rung of the income ladder, the 10th percentile, we're calling it, you didn't have income growth. You had your income shrink. In other words, you lost ground 3 percentage points. Your income diminished as opposed to grew. So this is also a part of our reality here in the Bay Area. We're always interested to put it in terms of what it takes to get by here. And if you are living in a household with one adult, one parent, and you have an infant and a preschool, we calculate that you need to be making $97 an hour and working full-time just to pay for food and rent. That's the level. And of course, we know in our region, our minimum wages don't come to that. Minimum wages are not living wages, just to be clear about that. Okay, we're going to talk about percentages that are living in without self-sufficiency. 28% of Silicon Valley households not self-sufficient. We got hammered in the Bay Area by inflation over the past year. So this is this punishing place for people that are trying to make it here, especially at the bottom ends of the income ladder, and inflation only made it worse. So we've documented that for you. We've also showed that child care costs are rising far faster than the inflation rate, so that's hammering our region. And then we need to talk about our health metrics. And then I'd love to get a respondent here on stage with me to talk about it even more deeply. So let's look at our health. People self-identify as whether they feel like they're in good health or not. And so when we asked that question to our population, the answer was, yes, I'm in good health. 62% of adults said that, 81% of our children say that. But guess what? That's a percentage drop, 6%, 6 points among adults, 5 among children. In other words, we're not feeling as well right now in Silicon Valley, so we need to unpack that. These are the leading causes of death. I won't detail that for you, but just so you know, COVID used to be a leading cause of death. We have since learned how to coexist with this new species that lives among us, and so it's fallen out of the top 10. That's encouraging, but there it is, leading causes of death in Silicon Valley. Mirror what we see in other parts of the country: cancer, heart disease, strokes. Segments of our population experiencing high blood pressure, diabetes. We're not making enough progress there. These are real issues here. We were interested to know how families are getting along with their medical bills, and it turns out that if you're a single parent and you've got kids, it's a real struggle for about 20%, let's call it 16, 18%. Really struggling to be able to pay medical bills, delaying important medical procedures. This becomes such an important question. Do you have health care coverage? Do you have that? Are you getting it through your employer or through some other means? So in this chart, you can see in the 2014 timeframe, there was the national introduction of the Affordable Care Act. And so that's when we saw our health coverages spike in Silicon Valley, and then we've been maintaining at that pace until last year, when there has been a precipitous decline in enrollment. This is a result, again, of policy measures that are being taken at the federal level. So now when we talk about Medi-Cal and other programs like that, they trace, their enrollment levels trace to eligibility requirements that are becoming more stringent and more labyrinthine, and then also just costs of enrollment. And so that's what we're observing in our county. So with that as a backdrop, I'm interested to invite Supervisor Ellenberg to join me on stage. Right here, please, if you would, Supervisor. Yep. Yep. She is a member of the Santa Clara County Board of Supervisors and also a member of the Joint Venture Board of Directors, a previous co-chair of the board. Join me on stage, if you would.
I don't have a microphone.
Oh, you need a mic, and that is right here.
I can whisper it out for us.
This is what you need right there. I think you have to push a button, though. Supervisor.
Good morning.
You oversee one of the largest healthcare operations in the state. That's a fact in Santa Clara County. I want to know how we're doing in light of these things that I'm just describing obliquely on the national scene. Update us.
Sure, thank you. Let me first just briefly
outline
why we are the second largest public hospital system in the state, because that wasn't the case until very recently. We owned and operated one hospital, Valley Medical Center, for decades. Mm-hmm. 2 hospitals in our county that were serving significant portions of Medicaid patients. That was O'Connor Hospital, owned by Daughters of Charity, and then Verity, and St. Louis Hospital in South County. Both of those for-profit providers threatened to close their hospitals. Verity went into bankruptcy. O'Connor and St. Louis were going to be sold. They decided, this is before Trump, before HR 1, that it wasn't sufficiently profitable to serve such a population that had so many Medicaid patients. Those hospitals went into bankruptcy. We looked at that situation and realized that if those hospitals closed, the burden on Valley Medical would be so enormous as to be unsustainable. It actually made sense for us to purchase them through the bankruptcy. We were the only bidder, such that those hospitals certainly would have closed 6 months before the pandemic started. So in retrospect, it was pretty prescient of us, but certainly can't take credit for that.
Take credit. Take the credit. I'm giving you the credit.
And then a similar scenario with Regional Medical Center. HCA was really cannibalizing one service after another. Again, it was impacting our system, and owning 4 hospitals presented tremendous economies of scale. Good contracts, workforce, care centers, and the model worked financially, even though we have 85% of Medicaid patients, because we were able to set the rates, and the Medicaid system, which has been in place since 1965, we thought was pretty reliable. The safety net services have really existed through Republican and Democrat administrations. There was no anticipation, no reasonable anticipation that H.R. 1 was going to so dramatically cut Medicaid. So that has changed the landscape for us.
Yes.
And now we are
So
functioning
here we are.
very differently.
Here we are. Okay, but a ballot measure recently.
Yes.
A comment, please.
Sure. We proposed a ballot measure to protect our healthcare services. The ballot measure, which passed with 57% of the voters, so thank you to at least 57% of you here, it covers about a third. We had been receiving about $2.5 billion in Medicaid reimbursements every year. We're now looking at about $1 billion budget hole for each of the next several years. That piece of Measure A funds covers about a third of it. We'll have about $330 million a year. Like the tech sector, we also are focused deeply on efficiencies right now, on consolidating services, on right-sizing departments, on making the decisions, painful decisions that we need to be able to reduce our own budget. We found $200 million of savings at our mid-year, which is highly unusual. It'll be another 300 or so at the budget, at the fiscal budget. The third piece of our three-pronged strategy is that we are aggressively working in Sacramento to ensure that the state legislators and governor's office first understand what it looks like in counties when significant portions lose their health care insurance and all of the cascading impacts. And we're trying to mitigate against, frankly, some of the additional harms that have been proposed with regard to cuts to Medi-Cal-only population, asylees, refugees, elimination of dental care, vision care, and other pieces that had been covered by insurance.
The ballot measure is not a panacea. You still have, we still have ground to cover. In 10 years, what does that look like for you?
I don't think that where we are right now can hold.
Yep.
And I'm speaking nationally, because I think the degree of harm that we're going to see with such large populations, not only the Medicaid population nationally, having significant numbers lose their insurance, but the covered California population, premiums are going up 97% without the subsidies.
Right.
So nationally, we will have so many more people without health insurance, which means we will have, number one, in emergency rooms, much longer waits for everybody, because that's the only place folks can get care. We will see more infectious disease in the community. We will see more absences from schools as rates of asthma and diabetes climb. We will see more deaths. We will also see tremendous economic changes for the folks that have commercial insurance. Their rates will go up because hospitals will have to increase their rates to cover uncompensated care. When we see this happening at scale nationally, I don't know, of course, how bad it has to get, but it will get bad enough that this trend won't stand.
Healthcare is this huge operation that you just described, but it's not alone and distinct. It also interweaves with other facets of care and social services that you're providing, including behavioral health, including mental health, including even CalFresh and those kinds of programs. Tell me about the integration of all of those things.
Sure. Well, the core work
Yep.
of counties is to provide safety net services,
Yes.
primarily health care to the indigent. We also administer, as you mentioned, the CalFresh programs, lots of other services. Everything, of course, is connected. And when people lose benefits, the impact is so much broader than to the individual. Because again, we see these impacts. We will see increases in poverty, higher risks to public health, and again, that economic piece. It really is connected. When you talk about taking someone's health insurance or mental health coverage, you're really starting the beginning of a spiral to an even greater disparity than the very frightening one that you laid out.
Okay, so last question. What do you recommend? What's the most important thing that we can be doing right now, working with these leaders in this room?
I think there are a couple of things that can be done. One is still the federal and state advocacy, because county governments, local governments can't backfill the enormity of these services. So I think protecting this care, absolutely understanding the role of public hospitals. Public hospitals make up only about 6% of the hospitals in the state, but we provide 50% of the trauma care. Our private hospital partners are also impacted by this because they are seeing more uncompensated care as well. So working with lawmakers, working with, frankly, philanthropists, public and private sector, to find opportunities to fill these gaps in what I hope is a less than a decade challenge. But even if the lights were to go on a year from now or 2 years from now, it will take many years to recover.
She's Supervisor Ellenberg on the Board of Supervisors for Santa Clara County. Thank you for your leadership.
Thank you for the opportunity.
Thank you. Thank you, Supervisor. Thank you. Well, let's continue talking. I'm going to go through this really quickly because I think you already understand it. In fact, I think you understand it quite intuitively. But that's our housing challenges. And I just want you to know that there's a real easy way to understand this, and this is it right here. The problem is that there's a pond out there. And if that wasn't there, then we would have 630 square miles that we would be developing into housing. This, by the way, is Kansas City, a thriving economy and a growing economy. But look, they don't face the same challenge. They can just sprawl as far as they want. As far as the eye can see, there's no impediment to that. Silicon Valley needed to be in that kind of a place. That's what needed to happen. But instead, we're dealing with these really protracted geographical constraints. What's going on here? Oh, you know, I showed you this. So remember, fixed landscape, surrounded on 3 sides by water, ringed by mountains, permanently protected open space. And then you take that landscape and you do this, right? That steep trajectory upward added 400,000 jobs over that 10 years going into the pandemic. And so that's your problem. Just understand that. That's your problem. An incredibly productive economy, no place to build houses. And so as a result, we have the highest rents anywhere in the nation. New York is in the 2nd place behind us. We have the highest median price homes when you measure that by sale price. It was 198,000 in, 1.98 million. So almost $2 million is the median sale price for your home. I did some quick arithmetic for you. I just want to show you this. So if you're buying that median priced home in Silicon Valley, it will cost you a down payment of almost $400,000. And then your monthly payment is about $11,000, rounded up to 12. That's your monthly. The down payment used to be the issue. Now the monthly is really the issue here. Now compare that to the national average. You can take your down payment and you can buy the median priced home outright. You can buy it for cash. You can do that. And look at your payment. It's the difference between $12,000 and $2,000. That's the difference. Okay, so we need to understand that. So as a result, this chart shows you 25% of the people, only 25% of the people who go to the bank to qualify for their financing are able to actually get that financing. This is a technical term. It means that you're burdened. You are burdened when you're spending more than 1/3 of your income on housing. Guess what? in Silicon Valley, we're spending half of our income on housing. So we're considered to be a region that's severely burdened, but a new finding in the index this year, it's especially burdening seniors. People that should be in their golden twilight years, it's not the case. They are burdened. They're heavily burdened, 67%. Now, we calculated what would your annual income need to be, your annual household income need to be to avoid burden. And it would have to be $433,000. That, by the way, is an increase of 50% over since the pandemic. So it's impossible. I think you already knew that. So I'm going to blow through this because I want to cover some other indicators as well in our remaining time. But the final question we always have to ask on housing is, are we building more? Are we doing that? And we are. We're making progress to the best of our ability, but there's still many impediments. Here's the number of permits issued. It's an improvement over the prior year, so that's good. Here's the amount of those units that were approved that are actually affordable, in the affordable range, not at the high end of the spectrum. And yes, we're making progress on that front too. Not enough, but people are tackling this like the crisis that it is. The cost of building that affordable unit of housing continues to go up. That's how much it is. It costs $800,000 to build one unit of affordable housing. And that's just like a tiny home or a duplex or something like that. And that's been a substantial increase of more than 100% over the past couple of years. We're in a new RHNA cycle. That stands for the Regional Housing Needs Assessment. Those are quotas that are handed down to us from the state, and we're not making good progress so far towards those quotas, but we have until 2031 to meet them, and so keep checking back here. We will update you every year. It leads to the precipitous rise of homelessness. We connect those two things. The high cost of housing also drives this number, which is 12,000. We have at least 12,000 people in the region who are unhoused. They're split between shelters and unsheltered, living in encampments or on the streets. Okay, we wanted to ask a question about how we're doing in school with our school kids, and are they making up the ground that was lost during the pandemic? And it's pretty much good news. So I'm happy to have some happy indicators here for a change. Dropout rate is falling, graduation rate is increasing. The share of students that are meeting the standard for 8th grade math has increased. It fell off during the pandemic. We've made up that lost ground. We're not doing the same at our standardized 3rd grade reading tests, so we have work to do there. And then, look, the share that are meeting the university entrance requirements here in the state, that share is also robust and has recovered since the pandemic, so that's good news. But I do want to talk about our mental health challenges, especially with that school set that I was just describing. This is the share of adults that are seeking help for addictions, dependencies, and other mental health issues. And this is a good news slide. We're glad to see that people are getting the help, self-identifying and getting the help that they need. It spiked up during the pandemic. It's fallen, but it's still at a level that's elevated above the pandemic. But here we have a look at the population that are experiencing psychological distress. And that describes 15% of our population. It describes 26% of young adults. And now have a look at this. It describes 35% of our teenagers. This is deeply troubling. And so we're going to talk about that we're going to bring another expert up onto the stage. We'll talk about this chart too. These are people who experience chronic sadness, feelings of alienation, hopelessness. Those portions of our population are also too high. And here's the share of teens that have actually considered suicide. Look, it's around 1 out of 10 have actually talking about suicidal ideation. So with that as our backdrop, I want to bring to the stage Dr. Joshi. And he's here from Stanford. Dr. Joshi, where are you? If you would join me on stage. He's at Stanford University. He is a medical doctor. He's with Stanford Medicine, but also affiliated with Stanford Medicine Children's Health, and he's working with these populations that are grappling with the issues that I've just described. Come on stage, Doctor. We so much appreciate you being here. There's your mic. Doctor, I've been describing this in the third person, as I am constrained to do. I'm just here to be the play-by-play, the clinician. You can talk about this in first person. What are you seeing yourself? Tell us about the shape of things.
Well, thank you for inviting me.
We're glad you're here.
Really appreciate it.
Yep.
I like how you started with a sports metaphor, because we're in the Bay Area.
Yes.
And, you know, the Warriors are giving us a little bit of hope. That's what I look for in the everyday, right? A little bit of hope. The youth are giving us hope. You just presented some pretty sobering stats.
Yep.
And so I'm a child psychiatrist, and I also raise future child psychiatrists as part of what I do. And I work with undergrads in my role in the Vice Provost's office. And so I'm seeing, and we are seeing, younger and younger presentations of these conditions that you just presented. We see middle schoolers who might be highly accomplished, going to high school, getting into good schools, or getting into a school they'd like to go to, but they may be silently struggling. We see early and earlier presentations of sleep deprivation, panic, in addition to anxiety and depression. And that's not unique to Silicon Valley. But I will say one of the things that we worry about a little bit is if we're raising young people who only see their success in terms of their grades, their accomplishments, you know, what kind of internships they get, then we're not cultivating the important pieces that I think align with the values of the folks in the room. You know, so we believe very strongly, and we know that the data show nationally that our kids have to be healthy enough to learn. And so when I speak with school boards and superintendents, the message is, quite simply, mental health is part of overall health, and our students have to be healthy enough to learn. And our teachers, who are part of the trusted adults around our students, have to be healthy enough themselves. They have to have the tools to reach and teach their students. Because there will never be enough child psychiatrists or pediatricians or nurse practitioners or family docs, but we can do the work together. And that is part of the message today, is what can we do individually, whether we're a CEO or whether we're part of Stanford or whether we're in the nonprofit sector. If you're a CEO, I would say, find out what your company is doing. You may know, you may be part of it, or you might have assigned a vice president who focuses on the well-being of your employees. How are the parents feeling that support? How are we modeling humane achievement norms? We can still pay attention to the bottom line, but we need a healthy workforce, right? So mental health being part of overall health. If you're a policymaker, we just heard from a very important leader and policymaker, then we need to be funding prevention, not as some niche clinical issue, but as part of infrastructure. And if you're in education, let's take a look at how we are doing our mental health trainings for the teachers. If you're a department chair in a university, like, don't make the trainings optional. They need to be mandatory. And so you have to provide protected time. For example, if you're in high school, you have to give teacher release time in order to do those advisory periods, in order to propagate these evidence-based peer programs. They do exist, but equipping the trusted adults around our students and the students themselves is the way forward. That's the way that we can scale it in these very trying economic times.
Can you tell us about the HERD Alliance?
The HERD Alliance, all right, thank you for asking. So HERD, like I heard you, have any of you heard of HERD? A few of you, thank you. Okay, HERD is an acronym, Healthcare Alliance in Response to Adolescent Depression and Related Conditions. Came together in 2009. It was an initiative of Stanford Children's Health and the Medical Center and Palo Alto Unified School Districts. In addition to, shout out, and in addition to the local hospitals. So it was mental health, primary care, and schools coming together because we found ourselves in the midst of a suicide cluster. And again, we find ourselves in the midst of a cluster right now throughout Santa Clara and San Mateo counties, not just Palo Alto. But we created a list of resources and we created a toolkit, and then we have a website, hurdlealliance.org, and what we do is we convene the best practices from national standards as well as what we know works, for example, with regard to health promotion. Mental health is part of overall health, starting in kindergarten, going through high school and into young adulthood. So it's a convening site for best practices, and it's a place where if there has been a crisis and you're trying to find out what we can do next, if there has been a death by suicide from someone in the community, how do we message? There are templated letters. There are examples of things a superintendent can do that very same day based on convened national practices. All of the resources are free of charge, and they're all located on the website. So that's probably the most impactful piece we do now, because it lives on the web, so people are downloading the resources from all over the world.
Can you tell us finally about student-led efforts?
Yeah, so probably the biggest student-led effort right now in the community that you may have heard about is called ALCOVE. ALCOVE, it's all lower letters, ALLCOV. How many of you have heard of ALCOVE? Oh, this is we got like 40% holding
Not
their
bad.
hands up.
Not bad.
ALCOVE is based on a model out of Australia, which is a best practice model, evidence-based model for youth drop-in mental health centers. So if you're a young person, 12 to 25, and you have an issue with mental health or physical health, or if you need to talk to social work because you're food or housing insecure, you need job training, it's a one-stop shop. A 12-year-old can walk in without their parents' permission. Obviously, we like to get the parents involved if there's parents at home, but a young person shouldn't have to feel that they need their parents' permission if that is holding them back. So the ALCOVE centers, now 6 around the state with 6 more to come online, are a really important part of what happens when young people who are more and more literate now when it comes to mental health. You know, people talking about the mental health crisis. Yes, it is harder than ever to be a young person now compared to when we were growing up.
Yep,
and I think you all realize that, right?
Yep.
How many of you are raising teenagers right now,
Yep.
or have raised teenagers? How many of you once were teenagers? It is a little different now. It is actually much harder. Now, it's also true that young people are creating resources for one another, right? They're reaching out on Instagram and other social portals in order to provide support. Some of those best practices, how do we talk about mental health? How do we talk about suicide and support each other? That's actually being developed by young people, overseen by adults. And you can find those resources on the website as well. But that does give me hope that the young people are really taking hold of this. The teachers and the trusted adults are paying attention here, I would say, within our San Mateo and Santa Clara counties, which is probably the majority of this group here. I think that the superintendents are paying attention and the school boards are, but we still have a lot of work to do.
Okay. Doctor, we've reached the end of our allotted time. I wish we could talk all day. I wish you'd come back. Let's do a podcast together.
I'd
You up
love
for
to.
that?
Thank you. Sign me up.
Dr. Joshi, Stanford. Thank you, Doctor.